Claudia Tuck is the director of the Alachua County Department of Community Support Services. Ms. Tuck previously served as the director of the Palm Beach County Division of Human Services and was formerly employed at the Oakwood Center of the Palm Beaches, where she was the associate director. She represents the Florida Association of Counties on the State Council on Homelessness, as well as the National Association of Counties, or NACO, Human Services and Education Steering Committee, and serves as vice chair of the NACO Social Services Subcommittee. In 2021, Ms. Tuck was reappointed by the NACO president to membership on the Veterans and Military Services Committee. She is a board member of the National Association of County Human Services Administrator and was elected to the position of president in early 2020. She is the past president of the Florida Association of County Human Services Administrators, having served in all officer positions. Ms. Tuck is currently a member of the National Association of Social Workers and the Academy of Certified Social Workers. She is a licensed clinical social worker. She received a Bachelor of Arts degree in International Relations and Sociology from the University of Delaware and a Master of Social Work degree from Florida State University. Ms. Tuck has been a field instructor at Berry University for Masters of Social Work students, as well as an adjunct faculty member at Palm Beach Community College. And we are very fortunate to have her here. Welcome, Claudia.
Thank you for having me, Mark.
You know, I talked to you a couple weeks ago and I said, we are doing such amazing things with permanent supportive housing and finding housing for people that need it. And as you well know, the board has spent a lot of energy on affordable housing in general, and this is kind of a subset of that. But if we could go back, Claudia, I think it's been about 5 years now since that initial kind of summer of 2016 meeting with the county and the city of Gainesville. Can you tell us a little bit about what happened then?
Sure. Both the city and the county recognized issues with homelessness, and as most are aware, initiated a program for emergency shelter. However, that seemed to be what we were focusing on here, and we were actually creating additional unsheltered homelessness with the rise of a tent city. So we brought in conjunction with the city, a consultant who came from Org Code, Ian DeJong, to evaluate all of the things that we were doing in Alachua County and make recommendations, again with the ultimate goal to house the unsheltered. That was a great assessment, and it really, I think, opened the eyes of a lot of our officials, as well as the public, to what we could do better and how we could really get people housed. It resulted in the development of an action plan that really laid the groundwork for going forward, and one of the main goals was to close the campground and begin to house people either directly from the street or from shelter, but not to move them from house to house in a transitional model, but to really look at permanent housing.
And Claudia, that was what I remember from that period of time was a very broad national discussion about, and I remember the phrase, there's only one solution to homelessness, and that's housing people. I think maybe the previous model was first you have to fix everything, and then you put people in housing. Right. And this was a pretty radical shift from that, was it not?
It was. This community felt like working through transitional housing was the best way to go, and really struggled with giving that up until they saw that it was starting to work. Mm-hmm. And when you realize that every time you move someone from one program to another while you're trying to fix their issues, you're creating more stress on them and ultimately often end to a relapse. Transitional housing nationwide has only been proven successful about 25% of the time, but permanent housing is typically successful 85 to 95%.
Well, when you put a homeless person in housing, that's 100% effective. They're not homeless anymore.
But you have to give them supports to keep
right,
them there. It's not that easy.
Well, and that's, we're going to go into that in detail because you're right. There's a great deal that goes with that. So then in the summer of 17, there were more kind of consultants, and the county and the city and the continuum brought in a consultant to review the kind of the governance and oversight. Tell us about that.
We did. We
summer.
worked with the National Alliance to End Homelessness because we recognized here locally that we had a structure that really wasn't working for the oversight. And the oversight is really important as you look to bring in additional funding. So Kay Mosher came down from the National Alliance, and she worked with us on governance and how we were proceeding, and that ended up with our oversight for the homeless continuum of care moving to the United Way of North Central Florida, so that there was one entity that was not really focusing on direct services themselves, but was looking more at the broader picture of the homeless continuum of care, and with a long-term goal of bringing in additional funding. And that, combined with moving away from transitional housing, has really helped this community to draw in new dollars.
I see. And then let's move to, I think it was early 2018. That was kind of the beginning of the rapid rehousing program. Tell us about that kind of transitional period.
We in social services work towards moving our staff into a case management model. Prior to that, they were focusing more on helping people with one-time assistance.
Okay.
So we did a lot of training with staff and brought in some new staff, and we used a state program under the SHIP funding, and that was the Rapid Rehousing Initiative.
I see.
The only issues we've had with that is that there's a lot of documentation, a lot of background research, a lot of material that's required for someone to qualify under that funding, and there are specific guidelines that the state requires us to have. So as we were working with individuals that didn't have some of the long histories, that worked really well. But as we get into a need for deeper end services, that program was not quite as adaptable to that population. We did house 122 individuals from the start of the program to current under the rapid rehousing model, and supported them. Rapid rehousing involves not just housing funding, but also case management support.
I see.
And typically you start out providing a certain amount of funding up to 100% of the rent, and then back down on how much is provided over a up to 2-year period.
And then in I think it was January of 19, you started to include short-term housing prevention case management and move-in case management. So I can see that the services are just getting deeper and more involved. Tell us a little bit about those.
Again, instead of just that one-time bill paying,
Right.
we recognize some households needed more of a light touch, but they needed some support for a couple of months. So as opposed to a longer-term rapid rehousing where you can be up to 2 years, we were assisting individuals either remain housed with case management or move to new housing for short-term. And we also used that state funding source for the move-in so that we could provide deposit assistance. And that's been a huge asset for our community.
I'm hearing the difference in the things you're saying about different sort of categories of folks, some that need some assistance, and then we're going to be talking more about permanent supportive housing and people that some might need assistance for quite a long time, perhaps the rest of their lives. But in the summer of 19, that was a really interesting period because that's when the county commission, having digested everything that you and your colleagues have been kind of exploring since that summer of 2016, they made some pretty big shifts in how they were going to approach this. So fill us in on that.
The commissioners did. They definitely heard what the consultants said, and they recognized that the end to homelessness is housing, and that involves additional resources from a financial perspective. Our county commissioners work with the city commissioners. They had multiple meetings and discussions, and the county proposed doubling the amount of money that was going into homeless services. And the suggestion was that every year over 3 years, the Board of County Commissioners remove $250,000 from funding emergency shelter and match that with another $250,000 towards permanent housing and rapid rehousing. so that at the end of 3 years, the city would be fully funding the emergency shelter campus at $1.5 million, and the county would be fully funding the permanent housing and rapid rehousing program to, again, a $1.5 million amount. There was a lot of discussion. There was not total agreement, but in the end, that is what was approved by the county commission, and that is what we proceeded with. And now that we are in 2021-22 fiscal year, we are fully funding the rapid rehousing and permanent supportive housing.
And the doubling met how much money?
$250,000 a year was added over 3 years by each party.
I see.
So there was an additional $1.5 million.
From each entity?
No, total across the
okay.
the two. So each entity added another $750,000.
I see.
So each was providing $1.5 million.
So a total of $3 million.
Is now going into homeless.
Right.
In addition to what else we are all both doing.
And you know, from my perception, it just made the whole thing cleaner. You had one entity doing one thing, one entity doing another thing, and you know, you didn't have to every year kind of, you know, get bogged down in, do we like how everything is going in each side? So that seemed to be a big improvement from my point of view. And then in mid FY21, or excuse me, FY19-20, the permanent supportive housing project began. Tell me about that.
Well, the funding was initiated to start with $500,000, and that was started in October of 19. So, of course, the first thing we had to do was to gear up staffing. Right. So we added a position and started a lot of training. It's a total different program when you're doing permanent supportive housing. Our staff are working with individuals directly from the street. All of the referrals for the program come through our homeless continuum of care through the coordinated entry process. So any of the outreach that's done across our county, any of the contacts by homeless individuals requesting housing are screened under an assessment that is called the VI-SPDAT. It's a vulnerability index to identify the level of support an individual would need to attain and retain housing. Right. Those are prioritized by, again, the independent homeless continuum of care, and there are case conferencing sessions that any entity that is placing individuals in housing meets on a regular basis every week to 2 weeks to identify that they could take on an additional individual to assist. And so that's how we do it. We don't select our own clients.
Right. And you know, it's important to understand the distinction between rapid rehousing and somebody who is, you know, temporarily found themselves to be homeless through, you know, factors out of their control sometimes, and people who have been on the streets for a long time, who, you know, perhaps will never have the job and be completely self-sufficient. And when people talk to me about the cost, Claudia, you know, gee, that seems like a lot of money. I always think about a story that I saw locally about one person who was tracked through the system, being homeless and dealing with the criminal justice system and other things. And I think that one person we totaled up $1 million price tag to constantly be dealing with the challenges of someone who's living on the streets. So, you know, when you multiply that by the number of clients you're serving, it's really a bargain in that respect. But can you give me an idea of what a case manager, first of all, for each case manager you have, what is the ratio of clients to case manager?
It's typically up to 15 individuals that one person would be working with.
Right.
And just to go on what you were saying, nationwide, on average, it costs about $40,000 to $45,000 to keep someone homeless, and those are the emergency room visits, the jail contacts, and the other services.
Is that annually?
Annually.
Yeah.
Whereas it costs about $20,000 to $25,000 on average nationwide to keep someone housed. The challenge is that it's not a one-for-one cost savings.
Right.
So that when you house someone in a situation, you don't necessarily recoup the funds from those other systems.
Right.
But you are improving their situation tremendously, as well as providing for society.
Right, right. Can you give me an idea of the services that a case manager, I mean, let's just look at one of their clients, a client who is perhaps on the far end of the spectrum in terms of what they need to remain in housing, and
Sure.
what does a case manager
Well,
do?
just to start with, when an individual is referred to us, oftentimes they've been homeless for 5 and 10 years. They have some disabling conditions. Many of them have multiple disabling conditions, and they are typically living on the street somewhere across our county. An individual who's referred to us, we first have to develop trust with them. That's a really important thing, is to build a relationship with that individual, to identify what it is they're looking for from a housing situation. Because just like you and I, we may not want to live in the same part of the county. We may not want the same type of an apartment. So looking at what their interests are, where they have had issues before, where they think they'll be the most successful, and then working with them to identify a setting that will work for them, a landlord that will work with them. Many of the individuals we are working with have criminal histories, have poor credit, as well as multiple other situations. Some may need an accessible unit. So we look at each person as an individual, as it should be.
Right.
Looking at them and valuing what they're interested in, listening to them. So that's a lot of working with them, is listening.
Right.
And then once we do locate a unit, we assist them with move-in, we assist them with setting up the apartment, help them get some furniture for the apartment if it's not furnished, and then teach them how to live in a house. Many individuals have not been under a roof and are not comfortable. We've had some individuals that may stay on the porch for the first week or two.
Right.
Just being in a house situation is not always a comfortable setting for someone who's been used to living unhoused. But ultimately, what we've seen are quite a few successes.
Right.
Individuals who take a lot of pride in their unit. We have one person who's very excited and has been decorating for the holidays.
Mm-hmm.
And she said it's the first time in her life that she's been able to do that and had a place. But our case managers are over there teaching someone how to mop a floor,
Right.
taking them grocery shopping, teaching them how to shop. It's basic teaching instructions that we wouldn't always think of. But again, looking at each person as an individual and what did they need to be successful.
You know, when people ask me about public service, I frequently talk about your department and the things that get you guys up out of your bed in the morning, and those success stories must be so meaningful to you.
Absolutely are. They keep us going.
So I imagine some people need continued assistance with just the necessities, food, household products. How do you handle that kind of support?
A couple of different ways. Of course, we access whatever mainstream benefits are out there that the person's entitled to apply for. So we may connect them with SNAP benefits, formerly food stamps.
Right.
We will look at their histories. If they're not receiving any kind of income and appear to have a disabling condition that will preclude working, we will connect them with Social Security and assist them with the applications to apply for benefits. If someone does have the ability to work, we work with Career Source to try and connect them to employment that might be beneficial to them, or work with other partner in the community who assist with employment. We do provide from our funding for initial setup of the units and also ongoing support if needed. And someone may need their rent paid for an extended period of time.
Right.
Until they can bring in some resources. There is an expectation that they pay 30% of their income towards rent, whatever that income source may be.
Right.
But that could be over an extended period of time that someone may not be able to pay rent.
Thus the term permanent supportive housing. You mentioned the priority list and how you determine. I'm assuming that's a fluid thing. If a new person comes into the system, you judge them or rank them within that list, and they don't necessarily go to the end of the list, that there are priorities that could move them up quicker?
That is done by the Homeless Continuum of Care.
Okay.
We don't do that in social
They
services.
make that recommendation to you?
They look at the new assessments coming in.
I see.
It's all ranked in the computer system.
Yeah.
But then we also have something in this community called dynamic prioritization that the Homeless Continuum of Care oversees and the governance board locally approves.
Mm-hmm.
And so that's how we've done some of the closures of the campground and the campsites.
Yeah.
Right now we're targeting the Main Street area.
Right.
And
by campground, you're talking about the Dignity Village
I am.
campground
I
that
am.
shut down, and
Right,
I
right.
know there's been great success in getting those people housing. And then in front of the fire station on Main Street downtown, there was another camp that I know you've been working on.
Right.
Yeah.
Right. We've been. That's who's currently on our list for being housed in permanent support.
So this is so intensive. Each caseworker covering or handling 15 clients. Tell me, how are we doing? How many caseworkers are there, and how many clients do we currently have in the system?
We're in the midst of hiring, so I believe we have 3 or 4 caseworkers currently on board.
Okay.
We have 46 individuals that we have placed in housing since we started, and right now we're working with 4 individuals to get them into housing, and we anticipate working with 15 individuals additionally this year in the permanent supportive housing.
Right.
We did initially anticipate having a certain number of permanent supportive housing case managers and rapid rehousing case managers, but in looking at the needs of the community, where we have a much higher number of chronically homeless, high vulnerability,
Right.
we determined that we need more in the area of permanent supportive housing, and did discuss that with the continuum of care. So we will, at the end of the day, only have 1 rapid rehousing case manager, and all the other positions will be focused more on the permanent housing.
This effort is obviously huge, but I know that there are other programs in your department that deal with homelessness. Can you tell me a little bit about that?
We do. There's all different stages. A lot of what we're doing now is homeless prevention, and that we've done for years. We're looking at it more as a holistic situation for the individual and assisting them with retaining their housing so they don't become homeless. But we're looking at what caused them to get in the situation of needing assistance, and that's what we talked about earlier, the couple of months of assistance.
Right.
But on average, we assist about 1,200 individuals with rent, mortgage, and utility assistance annually. We also have a lot of other programs that are supported by the Board of County Commissioners in our social services area. For instance, with prescription assistance, eyeglasses. We have also a program when an individual dies in the county. We assist with the final disposition.
Not to mention, I mean, you've also got the CAP and the Choices program that are funding nonprofits that provide services to so
Correct.
many folks in this community.
Correct. We also have our victim services and our
Right.
crisis service, crisis center. Both of those get involved with individuals who are either a victim of sexual assault or also who are suicidal and need to talk to someone 24/7.
Yeah. You know, I frequently get phone calls from people that are in need, and they find my phone number on the website, and I steer them to community support services because you all are just the experts on what is available, and even if it's something you don't provide, you know where to send them, and that's just so invaluable.
We have a great community of agencies that we work with. We have a great team of case managers and staff in the department. We're really very fortunate.
We only have 3 minutes left. I can't believe it, but I did want to point out that you all have taken the lead on the emergency rental assistance program. That I think the total is around $17 million in 2 different phases of that program. I know that you managed to get the first 8-point-something million out to people for rent and utilities. How has that been, working with that?
We've been very busy.
Yeah.
We received the initial funding in the very beginning of this year, started providing assistance in the middle of March. We're working with the third-party administrator, CRI. It's been a great partnership. They've done a great job helping us with the application processing. We are using a software system that is really able to help us process the applications. And our own staff are reviewing after the initial reviews by CRI and approvals. We do internal reviews, and our fiscal people do the processing, and of course the clerk cuts the checks. So
Yeah.
it's been a big team effort. We did fully expend the Emergency Rental Assistance 1 funding, which was $8.123 million. We applied for and were awarded assistance in the Emergency Rental Assistance 2 program. We have probably spent about 20% of that, and we just submitted a request to the federal government for the release of the remaining 60% of that. Additionally, we have applied for any reallocated funds from the Emergency Rental Assistance 1, because there really is a need in our community. I mean, we've seen it, they've come forward, and the individuals really have been impacted by COVID.
You know, particularly with the eviction moratorium running out, this program has really been the difference between people having housing and not having housing, and utilities, including internet, and it's just so important. I mean, permanent supportive housing is important, but not becoming homeless in the first place is such a huge thing.
Yes, it's another part of homeless prevention.
Yeah, and I can't believe we're out of time. Thank you so much, my friend, for joining us.
Thank you
It's
for
great to
having
see
me.
you.
An average of 26 million gallons of groundwater is used every day in the Gainesville area. Much of this is used on our lawns. Automatic irrigation systems must have a rainfall shutoff device by law. Please make sure yours is working. But to really save water and money, only turn your system on at the control panel when it hasn't rained for a while. Or even better, replace thirsty lawns with landscapes that don't need watering.
There's new irrigation rules at myyardourwater.org.